said. They even have a picture of it. They even have a picture of it, of a counselor with this white woman. She's sitting there. She gives her this little pill. And she says, with this little 10 milligram low-dose pill called Serapacil, we could get this woman straight. But remember, they said it mostly affected stay-at-home white mothers. That was in 1915. Little bit of counseling therapy. They can make them clean, cooperative, and communicative. Follow me on that? You follow me? They didn't mention anything about it affecting black people. Said mostly stay-at-home white European mothers. Now, fast forwarding to the 1950s and 60s, what was going on then? It was turbulent times. We just talked about it. We was protesting in the streets. We were, marching, whatever you want to call it. With Martin Luther King, the civil rights movement, we were doing whatever we could to bring about social change and justice for our people. So now, guess what the enemy did? To silence us, to discredit us, he deliberately changed and redefined the mental disorder that we know now is schizophrenia. In 1968, you can look this up, and I actually have the book to prove it. Before, when I was doing my talks, I didn't have no books because all my books were in North Carolina in storage. Well, I went back to North Carolina, I got my books, now I have them here with me in Pennsylvania to show you where I'm getting this information from. And most of the books that I have, the references that I have, they're written by white people. So no one can't say, oh, here he go with that black stuff. No, these are written by white people. Two psychiatrists by the name of Frank Simon, I believe, and Walter Bromberg, they came out with an article called Protest Psychosis. And I'm going to read to you what they said in this article. Pay close attention to this. What's their names? Frank Simon, yes, I had it right. Frank Simon and Walter Bromberg came out with articles. It's called The Archives of General Psychiatry. Listen what they said in this article that they wrote. They said, quote, Walter Bromberg and Frank Simon described schizophrenia as a protest psychosis, whereby black men developed hostile and aggressive feelings and delusional anti-whiteness after listening to words of Malcolm X, a student of the Most Honorable Elijah Muhammad, joining black Muslims and aligning with groups that preached militant resistance to white society. According to the authors, meaning Bromberg and Simon, men required now psychiatric treatment because their symptoms threatened not only their own sanity, but the social order of white America. Bromberg and Simon argued that black men who espoused to African and Islamic names and ideologies or adopted Islamic names that they changed in such a way to deny their previous Anglo-Saxon names, in fact demonstrated a delusional anti-whiteness that manifested paranoid projections of Negroes to the Caucasian group, and now they needed medication. That's what they said. So now they said anyone who listened to Malcolm X, not minister, but Elijah Muhammad, joined groups like the Black Panther Party, civil rights groups. Now they were showing a dangerous anti-whiteness, and they were in fact delusional, and they needed psychiatric treatment and eventually needed to be medicated. And they said now black men who used this and espoused to this teaching was now assaultive and belligerent. They even have a picture of it, family. This is an ad that they came out with. I don't know if you can see it. See, it says assaultive and belligerent, and they even have the medication now. It went from Serapacil, which was a 10 milligram pill, to this high-dose pill there called Halidol. Look at that black man with a fist. How did schizophrenia, which first they said was basically affecting stay-at-home white mothers, right? And with a low-dose pill, you could be rendered clean, cooperative, and communicative. I even have a picture of that. How did it go from being that to assaultive and belligerent and black men needing medication because they espoused and listened to Malcolm X, the Black Panther Party, the Civil Rights Movement? They changed and redefined schizophrenia. So now they had a justification to put black men, particularly black men that was in the Civil Rights Movement, in the Nation of Islam, or anyone fighting against white supremacy. Now they had a justification and a reason to put you in a mental institution and heavily medicate you. How do we know this is true? You can get this book. It's called Protest Psychosis. Look at that. How Schizophrenia Became a Black Disease. Written by that doctor, Dr. Jonathan Metzl, who is a leading psychiatrist still living here in America. He wrote this book. A white man. This ain't no black man. Minister Farrakhan and these black Muslims and these angry black men ain't write this book. Protest Psychosis. How schizophrenia, look at how he wrote it, became a black disease. He's telling you one of the leading psychiatrists in the United States, Jonathan Metzl, he wrote this book, How Schizophrenia Became a Black Disease. He's telling you that they changed and redefined the meaning and the symptoms for schizophrenia, a debilitating mental disorder, but they changed it to fit us, to discredit us, and to have a justification to take us off of the streets and put us in these mental institutions. Yes, see what they do? This was just back in the 60s and 70s. It's a hospital that they closed down outside of Detroit called the Iona State for the Criminally Insane. They put many of our brothers in that institution and they shut it down, I think in the mid-70s. It's called Iona State for the Criminally Insane. They locked up many, many black men and women in that mental institution, and many of them were in the Civil Rights Movement, the Nation of Islam, the Black Panther Party, and many, many other groups who were fighting actively in the street, fighting against white supremacy. This is what they did. I'm going to say it again. They redefined schizophrenia to fit us. How schizophrenia became a black disease. Unbelievable. So now, coming to present day age, they are doing the same thing with a lot of our boys in the school system. Dr. Umar, I have his book here. Get this brother's book. You don't got to agree with everything he says. The Psychoacademic Holocaust. My friend, Dr. Umar, I've sat down with him personally. I've even been to his home before. And I've learned a lot from him. But I'm not copying from him because I'm a therapist myself. And I work with black boys in the school system. Black children, Latino children, who most of them, they are now labeling them unjustifiably, in my humble opinion, with ADHD, conduct disorder, and oppositional defiant disorder, and heavily medicating them. Most of my children that I work with have these supposed mental disorders, these diagnoses of ADHD, oppositional defiant disorder, conduct disorder, impulsive disorder, and whatever else they want to come up with, when all they need is some discipline and an ass beating in their father and their life. This is the Hour of Power with Brother Sharif. Go to Hour of Power, Sharif Hamid on YouTube, subscribe and share so we can continue to lift the mind, body, and soul of our people. I'm not here, finishing up, I'm not here to tell you what you should do with your children. I just don't believe in it. I just don't. Almost 95% of the children that I give therapy to, and I go in their home and work with them and the family, they just need a father in their life. A father in their life. Attention, hyperactivity, deficit disorder, ADHD. Really. Dr. Umar said it really stands for ain't no daddy home disorder. I had to agree with him on that, because 95% of the children that I see is diagnosed with this, they don't have no father in their life. They just need some discipline, some consistency, and a proper diet. So I would thoroughly research what you're getting ready to get into if anyone out there has a child and they are approached by the school system, because they're the only ones asking you to put your children on medication. I would thoroughly research everything before you go putting them on these strong psychotropic drugs, if I was you. Now, why do I say I wouldn't put a 5, 6, 7, 8-year-old child on it? The most well-known used drugs to supposedly treat ADHD is Ritalin and Adderall. We've heard of it. The side effects I'm about to tell you, most of the other ones that they came out with, Strattera, Concerta, Vyvanse, Focalin, and a whole bunch of other ones that I can't even name, they're about to have the same side effects. You tell me, with these side effects, if you would even give this to a dog. Listen close and then I'll be done. These are the side effects, common and more serious side effects of most of the ADHD drugs that they prescribe to these children. Some children that only weigh 50, 60, 80 pounds. You tell me, after hearing these side effects, if you would even give this medication to a damn dog. The side effects of it, and this is coming from a therapist. This ain't what I think, what I feel. This is experience talking here, not what I think or feel, what I know. And I got this out of a medical dictionary. I have a DSM, which is a diagnostic statistical manual, which tells you all about mental disorders. This is the side effects that could happen, serious and common, with ADHD drugs. Here we go. Side effects: nervousness, agitation, anxiety, insomnia, stomach pain, loss of appetite, nausea, vomiting, dizziness, headache, vision problems, increased heart rate, increased blood pressure, psychosis, numbness. Stop right there. How can you function in school if you're dizzy? How can you function in school with a loss of appetite? The first thing they tell you to tell your children before you come to school is make sure you get a good meal so you can think and operate properly. Well, how can you get a good meal if because of the medication you're taking, you have a loss of appetite? How can you come to school and function right taking this medication that they have prescribed if you have insomnia? Insomnia means you can't sleep. Anyone knows in order for you to function, or any human being to function at work or school, you need at least, 8 hours of sleep. Well, if you have insomnia, that means you're up all night. I'm going to read them side effects again, and that's not all of them. Nervousness, agitation, anxiety. Anxiety is another mood disorder. Again, I'm a therapist. I know these things. Sometimes I have anxiety. Stomach pain, loss of appetite, nausea, vomiting, dizziness, headaches, vision problems. How the hell are you going to see what's on the board if you got vision problems? Dizziness, increased blood pressure, psychosis. Well, they're saying it's something not right what you're thinking in your mood. That's why they gave you the medication in the first place. Now one of the side effects is psychosis. Numbness. More serious side effects: fast pounding heartbeat, feeling like you might pass out, fever, sore throat, red peeling skin, aggression, restlessness, hallucinations, unusual behavior. Stop right there. They diagnose you with ADHD because they say your behavior is not normal. Now you mean to tell me the side effect of what they're giving you is going to give you unusual behavior? That's the side effect? Well, I thought you diagnosed and gave me the damn medicine because you said my behavior wasn't normal. I'm bouncing all around the place. I can't focus. Now the side effect of the medicine that you give me is going to give me unusual behavior? Sis said, I've seen kids walking around like zombies. Yes, that's what it does. I've walked in classrooms, sis, and they in there asleep and don't wake up until 11 and 12 o'clock. Easy bruising. More